We are continuing to do what we have been working on for the last 7 months and continuing to look at strategies to increase and expand those efforts. I feel confident that we will have we will be in a better position now to respond to a spike or an increase in cases than where we were in February and March, simply because we do have increased institutional knowledge, we do have increased experience, and we've had an opportunity to build and bolster our infrastructure for our response. We have continued to bolster our infrastructure, which is what we have been doing from the very beginning of the pandemic response, in terms of making sure that we have adequate provisions for the whole host of different components of the response. So including ensuring that we have adequate capacity to test, adequate capacity to conduct contact tracing, adequate necessary outreach to our congregate living spaces such as nursing homes and assisted living facilities, as well as constant communication with our hospitals and health system partners.
We made a decision in the beginning that we would accumulate enough supplies for a second surge, that we were not going to go into the fall and wait for a surge to happen and then be scrambling around like everybody had to scramble around last time. So we've been buying and making sure that we've got supplies on hand.
In April, actually, we made the move to acquire 50 hospital-grade ventilators. Those arrived over the summer. And so those will be in place and give us the capacity to support our hospitals through a deployment strategy should that become necessary in the fall in a way that would not have been possible in the early spring. And so we've been very proactive about making sure that we increase both our supplies. I had a conversation with, I continue to talk to our hospitals, to talk to them as much recently as Friday. And so we continue to talk to them, make sure that we're all prepared.
We know that regardless if it's a spike or just a sustained response effort, that those components are critical to moving forward and having a good response. Now, as it specifically relates to hospital capacity, the metrics that we have utilized on our dashboard have not changed. They are still important measures and proxies to determine the full impact and burden of the virus, particularly as proxies for severity of illness. And as you mentioned, we have a host of those metrics on our site, including the percentage of hospital beds in use, the percentage of hospital beds used for COVID-19, the percentage of ICU utilization, as well as the percentage of ventilators in use and other critical care equipment. The other measure that I want to draw attention to is we don't just rely on hospital-based measures, we also look at some clinical variables such as the number of COVID-like illnesses or COVID visits to the emergency room, again, as another proxy to see what the impact of the virus is and approximate utilization trends. Some of the contingency strategies that we have in place, for example, when looking at hospital utilization, as you recall, back in April and May, the hospitals had extensive plans in place. They continue to have those plans in place that look at how they can repurpose their facilities and their floor space based upon the trends that they're seeing in the community.